process of blood transfusion begins with a medical order. For this video, we will be using Oasis. Once logged on to the system, access your patient's file. Here you can see a medical order for a blood transfusion that has been added. Verify that there is a curtain type as green in the blood bank by communicating directly via trace line or by calling on the phone. If a blood sample is needed, follow the appropriate protocol to collect the blood sample. There is a memory aid for order of blood draw to help you, but the process of collecting blood samples will not be covered in this video. Your type and screen sample will be valid for 96 hours once it's been processed. Before going any further, check your patient's vital signs. A baseline must be done within the same hour before starting your transfusion. If there's anything out of the ordinary, do not order the blood and inform the physician. Everything looks fine here. Let's continue. Next, let's talk about the pickup slips that are required for documentation and verification when a product is being picked up from the blood bank. The first type of slip you could use is the Oasis medical order that has been printed. At the bottom, there is the pickup slips section. There are also yellow tearaway slips available on the unit. One of the two pickup slips is required by the blood bank in order to release the product. The PB has delivered your blood to the unit. Now it's time to ask a colleague of yours to accompany you as a witness to go and verify the blood product with the patient. If you're unable to begin your transfusion in 30 minutes after receiving the blood, make sure it's returned to the blood bank. You cannot store it in the fridge on your unit. Open up the contents of the plastic bag to begin performing your checks. Don't throw away the Ziploc bag. You will use it at the end of the transfusion. Now it's time for the nurse and the witness to check all 8 points that are listed on your green voucher. Be sure to check all the boxes as you go. First step is to verify the MRN number and the patient name, both on the voucher and the blood product. Next, verify the product name. Check your blood type. Verify the donation number. Check the expiry date. Look for any particulars associated with the directives. Next, look at the blood product. Inspect it by gently flipping it over and inspecting the blood. Time to do the patient identification. Verify the bracelet and make sure it matches with the information on your product and voucher. Confirm the patient's identity with them. And then confirm it with the bracelet and the name and date of birth on the product and voucher. Now that all the verifications are complete, the witness needs to sign the voucher. The next person to sign is the primary nurse who will be giving the transfusion. Once the product has been verified by the two healthcare professionals, it cannot leave the patient's bedside. Here's all the list of equipment that you're going to need to provide a transfusion. Please note that the products must be given within 4 hours of the time they were sent from the blood bank, not from the start of the transfusion. Ensure that there is a main NS line that has already been primed and is ready to go. Time to spike both the NS bag and the blood bag. Please note that it's safer to spike a bag off the pole to decrease the chance of puncturing the bag. Turn on your pump and say yes to priming the line. Invert your drip chamber so that it fills upside down. Once it's filled, clamp your saline line and open the blood line. The pump will ask you if you want to prime again. Say yes. Now you will see the blood starting to flow down from your blood bag, and it will drip onto the NS in your chamber. Having the blood fall on NS and not filter directly will decrease the chance of you damaging the blood cells. Make sure that you have primed the tubing so that blood is all the way to the tip of your tubing. If your patient is not already connected to the maintenance NS line, do so now. Ideally, your patient should already have an IV infusing to prevent potential delays if your IV infiltrates after your blood has arrived. But for the purpose of this demo, we're connecting the IV right before the transfusion starts. Don't forget to scrub the hub for 15 seconds with chlorhexidine. Check the patency of your IV by flushing with NS. Connect the primary line of NS to your patient's IV, if it's not already in place. The blood will then be connected to the proximal port of that NS line. With a new swab, scrub the hub of that proximal port for 15 seconds. And connect the blood line to that port. Now you need to access the drug library on the infusion pump. Select blood products and press OK. Scroll down until you find PRBCs. Select use of blood tubing. You will see here that the pump is pre-programmed for the first 15 minutes at a rate of 50 cc's an hour. And press the start button. At this point, the transfusion has started. That means the nurse needs to stay in the room with the patient for the first 15 minutes because of the risk of transfusion reaction. Remember, the 15 minutes only starts when the blood enters the patient's vein. Here, our 15 minutes begins. On the green voucher, indicate the date and exact time that you started the transfusion. 15 minutes has passed. It's now time to increase the infusion rate. But first, check your patient's vitals. If the parameters exceed the threshold indicated in the protocol, stop the transfusion and alert the physician. Everything looks fine here. There have been no transfusion reactions, so we can increase the rate on the pump. Stop the infusion and select the volume to be infused from the menu. When calculating the volume to be infused, check the volume on the blood bag and then subtract the volume that you just gave in the first 15 minutes. You now need to select how much time you want the transfusion to run for. For this demonstration, we're running the transfusion over 3 hours. Based on the patient's tolerance, this could be adjusted. Please remember that you cannot exceed 4 hours from the time that you receive the blood. Now that the 3 hours has passed, take your patient's vitals one last time. Everything looks good. The transfusion was a success. Make sure that the blood bag is empty and unclamp your saline line. The saline will then rinse the rest of the blood out of the tubing. You don't want to waste any of your blood product. Disconnect the IV line from your patient. Don't forget to scrub the hub. Remove the tubing from the infusion pump and place everything into the plastic bag that came with your product. In the comments section on your green voucher, you can add information such as patient teaching done for transfusion reaction, the rate that you started your infusion, and how it was tolerated by the patient. According to documentation practices, if the patient does not experience any adverse reaction, nothing needs to be added in the progress notes. Be sure to indicate the time of completion, the volume that was transfused, and your signature on both portions of the voucher. Now that the green voucher is completely filled out, you can tear away the bottom portion. The top goes in the patient's chart, and the bottom is returned to the blood bank. The blood product and its tubing is stored in a designated bin on all units for a period of 24 hours in case of a delayed transfusion reaction.